In this video, we are going to discuss about pediatric drug doses. So, just let us begin with the antibiotics. Before beginning, let me assure you that this video is just for educational purpose. Please visit your doctor before taking any medications. The doses are decided by the doctors, your pediatrics doctor. Here we go. First of all, the injection ceftriaxone. Its formulations are 250 mg over 2.5 ml, 500 mg over 5 ml, 1 gram over 10 ml, and 2 gram over 20 ml. The dosage is 80 to 100 mg per kg per day daily, and we can use shortcut formula like weight into 1 ml daily. Here is one example. If a a baby has 8 kg, then ceftriaxone is prescribed as 8 kg, so 8 ml plus 100 ml with electrodextane IB at the rate of 100 microdrops per minute started daily. Next, we have antibiotic amikacins. Its formulation is 100 mg per 2 ml, 500 mg over 2 ml. The dose is 15 mg per kg per day. We give it BD or 12 hourly. Shortcut for this is weight into 0.15 if the formulation is 100 mg per 2 ml, but if the formulation is 500 mg per 2 ml, the formula becomes weight into 0.03 ml. Next is ceftazidime. We have these formulations. We can see the dosage is 100 mg per kg per day BD, and shortcut we have is weight divided by 2, 12 hourly. Next is cefotaxime. For that we have the dose 100 mg per kg per day 12 hourly. Shortcut is weight by 2 BD. Next is injections ampicillin 250 mg, 500 mg and 1 gram. The dose is 100 mg per kg per day 12 hourly for neonates and 6 hourly for more than neonates, means for infants. In case of sepsis, we can prescribe 200 mg per kg per day 12 hourly. In meningitis, we can prescribe 400 mg per kg per day 6 hourly. The next is meropenem. We have formulations for 250 mg, 500 mg and 1 gram. The dose is 30 mg per kg per dose. We can prescribe it 8 hourly, but in meningitis it's become 40 mg per kg per dose 8 hourly. Shortcut is for normal infections we can prescribe 0.6 weight into 0.6, and for meningitis we can prescribe weight into 0.8 ml TDS. And next one is injection levofloxacins, which comes in market with the formulations of 500 mg over 100 ml. The dose for this is 15 mg per kg per day, which is given daily. And if the patient is less than 1 year, we can give 15 mg per kg per day 12 hourly. Shortcut is weight into 3 daily. Injection metronidazole 500 mg over 100 ml. The dose is 15 to 30 mg per kg per day 8 hourly. We have shortcut for this, weight into 1.5 ml TDS. Ciprofloxacins 200 mg per 100 ml. The dose is 15 to 30 mg per kg per day 12 hourly. We have shortcut, weight into 5 or 6 ml per BD. This is decided by your doctor. Injection cefepime 500 mg over 5 ml or 1 gram over 10 ml. The dose is 100 mg per kg per day 12 hourly or 150 mg per kg per day 8 hourly. We have next vancomycins 500 mg over 100 ml. The dose is 45 to 60 mg per kg per day 8 hourly. We have the shortcuts, weight into 3 or 4 ml TDS. We have to give double dilutions. The side effect is Redman syndrome. We can see this is Redman syndrome. We have the next flucloxacillins with the formulation to 50 mg over 2.5 ml and 500 mg over 5 ml. The dose is 550 to 100 mg per kg per day 6 hourly. The shortcut for this is weight into 0.25 ml. Next is injection gentamicins with the formulation 200 mg over 2 ml and 800 mg over 2 ml. The dose for neonates is 2 to 5 mg per kg per day BD, and for children 4 to 6 mg per kg per day BD. We have shortcuts weight into 0.12 ml BD. The next is injection linezolid 600 mg over 300 ml. The dose for this is 30 mg per kg per day, 8 hourly. Shortcut it weight into 5. We have injection clarithromycin 500 mg over 10 ml. The dose is 15 mg per kg per day, 12 hourly. Next is injection piperacillin plus tazobactam 2.25 mg and 4.5 gram. The dose is for 2 months to 9 months. We have 80 mg per kg per dose, 6 to 8 hourly, and for 9 months to adult we have 100 mg per kg per day, 6 to 8 hourly. Next is injection dexamethasone 5 mg over 1 ml. The dose is 0.08 to 0.15 mg per kg per dose, 6 to 8 hourly. Next is injection furosemide 20 mg over 2 ml. Dose is 1 to 2 mg per kg per day, daily BD or TDS. Shortcut is weight into 0.1 ml daily BD or TDS. Next is injection diazepam 10 mg per 2 ml. Dose is for IV we have 0.3 mg per kg per day. For rectal 0.5 mg per kg per day. For rectal shortcut is weight into 0.1 ml per rectally, and oral we have 1 to 2 milligram per kg per day. Example, if the baby with 5 kg came, we prescribe injection diazepam 10 mg per 2 ml plus 3 ml distilled water, total becomes 5 ml, 0.5 ml per rectally. Stat injection phosphonatoin, injection phenobarbital 200 mg over 1 ml. We mix with 9 ml distilled water and becomes 200 mg over 10 ml. The loading dose is 20 mg per kg per dose. Shortcut is weight into 1. Stat is given. And maintenance dose is 5 to 6 mg per kg per dose, 12 hourly. Shortcut is weight divided by 8. It is given PD. Injection phosphonatoin sodium 100 mg over 2 ml, which is mixed with 8 ml to make 10 ml and becomes 150 mg over 10 ml. The loading dose is 30 mg per kg per dose. Shortcut is weight into 2. IV stat and slowly. And maintenance dose is 75 mg kg per day, 12 hourly. Shortcut is weight by 4 ml IV BD. We have next injection ranitidine 50 mg per 2 ml. Dose is 5 mg per kg per day, 12 hourly. Injection timonium methyl sulfate 5 mg over 2 ml. Dose is 1.2 mg, 1 to 2 mg kg per day, 8 hourly. Next is injection ondansetron 8 mg over 5 ml. Dose is 0.2 to 0.4 mg per kg per dose, 8 hourly or SOS. Injection acyclovir 250 mg over 50 ml. Dose is 10 mg per kg per dose, 8 hourly. Injection vitamin C ascorbic acid 500 mg over 5 ml. The dose is, if the patient is less than 1 year, we prescribe 100 mg daily. But if the patient is more than 1 year, we prescribe 200 mg daily. Next is injection calcium gluconate 500 mg over 5 ml. The dose is 0.5 to 1 ml kg per dose. Next is injection sodium bicarbonate with the formulation 7.5 mg over 100 ml. The dose is 0.5 to 1 ml per kg per dose. Injection midazolam 500 mg over 5 ml. The loading dose is 0.1 to 0.2 mg per kg per dose. We have shortcut 0.8 into 0.15 ml IV stat, and maintenance dose is 1 microgram per kg per minute to be allowed. The shortcut for this is weight into 1.5 ml is in each 100 ml of the IV fluid. Next is the infusions amino acids plus disorbitol plus electrolyte. The dose for this is 8 ml, 3 ml per kg per day. We use this to maintain the nutrition in NPO patients. Next is infusion mannitol 20%. It comes in the formulations of 100 mg per 500 ml bottle. The dose is 0.5 gram per kg per dose. We prescribe 8 hourly. For nebulizations, if the patient is less than 6 months, we prefer ipratropium bromide. But if the patient is more than 6 months, we prefer salbutamol. Shortcut is weight into 0.03 ml plus normal saline. Total we have to make 3 ml. We can use this formula as well. Weight into 0.355 ml plus normal saline. Next is injection quinine, 300 mg over 5 ml. This dilutions with 10% DA should be done over 4 hours to prevent hypoglycemia. Loading dose is 20 mg per kg per dose. Maintenance dose is 10 mg per kg per dose. We prescribe it 8 hourly. Next is injection KCl, which comes in the market with 1.5 gram per 10 ml. The dose is 3 to 4 millimole per kg per day. And injection KCl 1 ml in each 100 ml fluid. We see this label and the corrections. If the potassium is 3.5 millimole, then 1 ml KCl contains 2 millimole. Like this. Please go through this chart. Injection magnesium sulfate 2.47 gram per over 5 ml. In first day we prescribe 50 mg per kg per hour for 5 hours. In second day we prescribe 50 mg per kg per hour for 3 hours. In third day we prescribe 50 mg per kg per hour for 1 hour. Injection elemental irons, iron in hydroxide sucrose complex 20, 50, 100 and 200. Shortcut is weight into 0.15 ml, 1 ml diluted with 20 ml of the normal saline, usually over 1 hour in every alternative days. Injection cholestyramine sodium, cholestyramine sodium 1 million international unit over 100 ml, dose is 2500 international unit per kg per dose, 8 hourly. Next is injection prostaglandin 500 microgram per 1 ml, dose is 0.05 to 0.1 mg per kg per minute. It is almost 10 to 50 microgram per kg per minute. Injection fentanyl, which comes in the market with 100 microgram per 2 ml, loading dose is 1.4 microgram per kg per dose. Maintenance is 1 microgram per kg per hour. Injection dopamine, which comes in the market with 200 milligram over 5 ml. The dose is 5 to 10 microgram per kg per minute. Average we can take 7.5 microgram. If the baby has 5 kg weight, then injection dopamine is given with 0.9 normal saline and the 23.1 ml normal saline 1 ml hour each hourly through the syringe pump over 24 hours. The shortcut formula is weight into dosage into 24 into 60 by 1000 into 40. This is the shortcut. Next is injection dobutamine 250 mg over 5 ml. Dose is 5 to 10 microgram per kg per minute. Average we take 7.5 microgram as in dopamine. The shortcut formula is almost same. Weight into dose 24 into 60, 50, 100 stacked. Next is injection adrenaline, which comes with 1 mg over 1 ml, in which we mix 9 ml of the normal saline to make 1 mg over 10 ml normal saline. Loading dose is 0.3 ml per kg IV stat and maintenance dose is 0.1 to 0.3 microgram per kg per minute in syringe pump. Maximum 3 times loading dose can be given. Loading dose with dilutions but maintenance dose without dilution because syringe pump works on the IVF. Neonates 24 ml and for PICU we give 48 ml. For 2 kg baby loading dose should be 0.3 into 2, that is 0.6 ml or 60 unit IV stat. Injection noradrenaline, which comes in the market with 4 mg over 2 ml. The maintenance dose is 0.1 to 0.3 microgram per kg per minute. 1 mg is diluted in the 15 ml of the normal saline. Injection aminophylline, which comes in the market with 125 mg over 5 ml. The loading dose is 5 mg over kg. Maintenance dose is 0.7 mg per kg per hour. Injection hydrocortisones 100 mg over 2 ml. The dose is 5 mg per kg per dose 6, which can be given PD, TDS or QID. Injection omeprazole sodium 40 mg, which is diluted with 10 ml of the distilled water. The dose is 0.5 mg per kg per dose BD. Now next let's discuss some syrup. Syrup azithromycin, which comes in the market with the 10 mg over 5 ml. 1 TSF equals to 5 ml. We know this. The dose is 10 mg per kg per day daily. Example, if for the baby 10 kg half TSF daily. In case of enteric fever, we prescribe 20 mg per kg per day daily for 5 days. Syrup Cefixime 100 mg over 5 ml. The dose is 10 mg per kg per day. BD for intense fever 20 mg per kg per day BD. For the 10 kg baby, TSF BD for 5 days. Inject syrup cefuroxime 125 mg over 5 ml. The dose is 15 to 30 mg per kg per day. To be hourly for 10 kg baby, 1 TSF BD. Syrup cephradine 125 mg over 5 ml. Dose is 50 to 100 mg per kg per day. 6 hourly for 10 kg baby, 1 TSF QDS. Syrup erythromycin 125 mg over 5 ml. Dose is 50 to 100 mg per kg per day. 6 hourly for 10 kg baby, 1 TSF QDS. Syrup flucloxacillin 125 mg over 5 ml. Dose is 50 to 100 mg per kg per day. 6 hourly for 10 kg baby, 1 TSF QDS. Syrup amoxicillin 125 mg over 5 ml. Dose is 50 to 100 mg per kg per day. 8 hourly for 10 kg baby, 1 and 1/3 of the TSF TDS. Syrup levofloxacin 125 mg over 5 ml if the baby is less than 1 year, 12 hourly if the baby is more than 1 year, daily. 10 kg baby, 1 TSF daily. Cefaclor 125 mg over 5 ml. Dose is 20 to 40 mg per kg per day. 8 hourly for 10 kg baby, 1 TSF TDS. Injection cefodoxime 40 mg over 5 ml. Dose is 10 mg per kg per day. 12 hourly for 10 kg baby, 1 and 1/4 TSF BD. Syrup ciprofloxacin 250 mg over 5 ml. Dose is 15 to 30 mg per kg per day. 12 hourly for 10 kg baby, half TSF BD. Syrup metronidazole 200 mg over 5 ml. Dose is 15 to 30 mg per kg per day. 8 hourly for 10 kg baby, half TSF TDS. Injection phenoxymethylene penicillin 250 mg over 5 ml. Dose is 50 mg per kg per day. 6 hourly for 10 kg baby, half TSF QDS. Syrup nitrofurantoin 250 mg over 5 ml. Dose is 5 to 7 mg per kg per day. BD, TDS or QDS for 10 kg baby, 1 TSF BD. Syrup albendazole 200 mg over 5 ml. 1.5 year to 2 years, 1 TSF stat, then 1 TSF after 7 days. After 2 years, tablet albendazole 400 mg, 1 tab stat, then 1 tab albendazole after 7 days. Syrup mebendazole 100 mg over 5 ml. Before 2 years, 1 TSF BD for 3 days. After 2 years, tab mebendazole 100 mg, 1 tab BD, TDS or QDS. Syrup parental pamoate 500 mg over 10 ml. After 1.5 years, 10 mg kg, 10 mg over 1 kg at night stat, and repeat after 3 days. For 10 kg baby, half TSF stat, half TSF after 3 days. Syrup levamisole 40 mg over 5 ml. Dose is 3 mg per kg per dose stat. For 10 kg baby, 3/4 TSF stat. Syrup nitazoxanide 100 mg over 5 ml. Dose is 10 to 15 mg per kg per day, 12 hourly. If it is less than 1 year, half TSF 3 days. If 1 to 2 years, 1 TSF BD for 3 days. 3 to 12 years, 2 TSF BD for 3 days. More than 12 years, 1 tap 500 mg BD for 3 days. Syrup prednisolone 5 mg over 5 ml. Dose is 1 to 2 mg per kg per day, 8 hourly for 10 kg baby, to 30 SF TDS. Syrup sodium valproate 200 mg over 5 ml. Dose is 20 to 30 mg per kg per day, 12 hourly. Up to, it can be given up to 60 mg for 10 kg baby, half TSF BD. Syrup ketotifen 1 mg over 5 ml, 6 months to 3 years, half TSF BD can be given. More than 3 years, 1 TSF BD. Syrup salbutamol 2 mg over 5 ml. Dose is 0.3 mg per kg per dose, 8 hourly for 10 kg baby, half TSF TDS. Syrup zinc sulfate monohydrate, which it comes in the formulations of 5 mg, 10 mg and 20 mg. Dose is 2 mg over 2 mg per kg per day over 12 hours for 10 kg baby, 1 TSF BD. Injection timonium methyl sulfate 10 mg over 5 ml. Dose is 1 to 2 mg per kg per day, 8 hourly or 12 hourly for 10 kg baby, 1 TSF BD. Syrup fexofenadine 30 mg over 5 ml. Syrup dose is 2 mg per kg per day daily for 10 kg baby to 30 sf daily. Syrup potassium chloride 500 mg over 5 ml. Dose is 3 to 4 millimole per kg per day. Less than 6 months FTSF, more than 6 months 1 TSF BD or TDS. 1 TSF equals to 500 mg equals to 6.7 millimole. Syrup Piracetam 500 mg over 5 ml. The dose is 50 mg per kg per day, 12 hourly for 10 kg baby, half TSF BD. Syrup naproxen 125 mg over 5 ml. Dose is 15 mg per kg per day, BD for 10 kg baby to TSF BD. Syrup ibuprofen 100 mg over 5 ml. Dose is 40 mg per kg per day, BD or TDS for 10 kg baby to TSF BD. Syrup domperidone 5 mg over 5 ml. Dose is 0.2 to 0.4 mg per kg 8 hourly. Syrup phenobarbital 20 mg over 5 ml. Dose is 2 to 5 mg per kg per dose. Single to 12 hours 8 hourly. It can be used in the seizures and PNA with HIE stage 2 with repeated convulsions. Syrup ondansetron 4 mg over 5 ml. Dose is 0.2 to 0.4. We can use average of 0.3 mg per kg per dose. TDS or SOS. There might be the side effect of the diarrhea. So be aware of diarrhea. Syrup ranitidine 75 mg over 5 ml. The dose is 5 mg per kg per day. Syrup salbutamol 1 mg over 5 ml for 1 year to 6 year. Half TSF TDS for 6 years to 12 years. 1 TSF TDS for more than 12 years. Tap salbutamol 1 mg TDS can be given. Now let's discuss about the suppository. It comes in the formulations of the glycerol 1.15 gram or 2.3 gram. For neonates, we prescribe 1.15 gram, 1 stick per rectal stat. 6 months to 12 years, 2.3 gram, 2 stick per rectal stat. More than 12 years, 2.3 gram, 4 stick per rectal stat. Nebulizer solution salbutamol 1 gram over 1 ml. Dose is 0.15 to 0.3 milligram per kg per dose. Capsule retinol vitamin A, which comes in the 50,000 international unit. If the patient is less than 6 months, 1 capsule. If 6 months to 2 year, 2 capsule. If more than 2 year, 4 capsule. In xerophthalmia, we prescribe in first day, second day and 14th day. But in case of measles, we prescribe in first day and second day. Tab levothyroxine, which comes in the market with 25 microgram, 50 microgram and 100 microgram. For neonates, 10 to 15 microgram per kg per day daily. For infants, 4 to 5 microgram, 4 to 5 microgram per kg per day daily. Pediatric drop simethicone 67 mg per over 1 ml. The dose is 2 drops per kg per dose. QDS. It can be used in case of infantile colic. For if the baby is 5 kg, 10 drops per orally. QDS for 10 to 15 days. Capsule doxycycline 50 mg or 100 mg. Dose is 5 mg per kg per day daily or BD. For 10 kg baby, 1 capsule 50 mg daily can be given. Pediatric drop erythromycin 50 mg over 1.25 ml. Dose is 5 drops per kg per dose. QDS. Pediatric drop cefaclor 125 mg over 1.25 ml, 1.2 ml. The dose is 2 drops per kg per dose. TDS. And we have formula milk F75, which contains of 1 TSF milk 20 kilocalorie, 1 TSF sugar 20 kilocalorie, 1 TSF vegetable oil 45 kilocalorie and 1 TSF milk mixed with 30 ml of the water. Total 10 feeds per day should be given. And we prescribe as NG feeding with formula milk. Let's discuss about the difference between F75 and F100. In F75 there is milk of 1 scoop, but in F100 there is 3 scoop, sugar 2 scoop 1 scoop, vegetable oil 2 ml 3 ml, water 100 ml 100 ml. So let's see some shortcuts. We love shortcut. And for weight into 0.1 we can use for furosemide, ondansetron, hydrocortisone and diazepam. For weight divided by 2 we can use to ceftazidime, ampicillin and cefotaxime. and weight into 1.5 can be used for metronidazole, weight into 5 for ciprofloxacins, and so on. Thank you, that's all.